Hello, I'm Dr. Maury Markman from City of Hope, and I'd like to discuss in this session, Ms. Markman, another ASCO abstract dealing with a very interesting topic, one that is fraught with hazard and will only become increasingly difficult and important in the future. There is a major issue in oncology as we are learning increasingly about the importance of genetic germline associations with a variety of malignancies. I think those of you listening to this are aware of that. We certainly have known this for very many years, in fact, decades, with ovarian cancer and breast cancer. Increasingly, we recognize the importance of germline associations with prostate cancer, with pancreas cancer. There's evidence now in GU tumors that this is not rare, and certainly even in lung cancer. The point you made is when an individual is diagnosed, the question comes up, do we need to do genetic testing? And if we're talking about germline here, I'm not talking about somatic. If we are going to do germline testing, it raises the question of families and of potentially genetic counselors. But there are simply not enough genetic counselors to be able to undertake this task, particularly as the population of relevance grows. And of course, there's also the time, effort that goes into this. And it's not just genetic counselors, of course, it can obviously be the individual physicians. And how experienced are the individual physicians to be able to discuss the issues that are inherent in the question of germline abnormalities? So that's the background. So the abstract that I'm referring to is entitled Video-Based Genetic Counseling to Reduce Physician Overload and Enhance Understanding, a prospective randomized clinical trial. This is actually a study that was conducted in Germany. It's a randomized study looking at breast and ovarian cancer patients. Patients are randomized to what the authors described as standard of care, which was a physician discussing issues of genetic testing with the patient. This is Germany. Or a physician-based, a video-based a presentation to the patients, followed by a physician genetic counseling. So either physician talked to the patient directly, these were breast and ovarian cancer patients potentially, or there was a video followed by the physician. Randomized trial, 100 patients with a median age of 47. As the abstract stated, the population was well balanced in terms of the patient populations and a variety of other patient-related characteristics. The bottom line in this randomized trial, the use of the video improved comprehension scores, which are analyzed in this population, from 62.5%. Again, the scales these were objective scales, but improved the comprehension scores from 62.5% to 81.3%. So the patients, when they finished this, had a greater understanding of what was going on, the purpose of the testing, what the outcome would be after the testing, had an improved understanding watching the videos first. But in addition, there was a reduced time spent counseling by the physician from 6.6 minutes to 2.4 minutes. Now, again, the details of the counseling session are not described, but they're obviously measured, and the time was reduced almost by a third. And yet, the understanding by the patients increased considerably. I would suggest that this particular model, and by the way, in the abstract, the authors noted that the tool can be translated into English from German. But more importantly, This is simply an example, one example of a strategy. We're talking about presenting videos that have been clearly looked at, examined for educational content, level of educational attainment to be able to understand. These videos can be prepared to assist clinicians and counselors in the description to patients about what germline testing means, what the implications are. And we need to be able to focus on these types of strategies so we provide the adequate level of understanding for patients, in contrast to what could happen instead is the testing is simply not performed, and that would be very problematic. And I thank you for your attention.